In the March 2016 issue of JACC Heart Failure, there is a paper on pathogenic gut flora in patients with chronic heart failure, and there is accompanying editorial comment, "We are not alone, understanding the contributions of intestinal microbial communities and the congested gut in heart failure." And I'm with the author of this editorial comment. This is W.H. Wilson Tang, who is an MD, correct? Director of the Cleveland Clinic Center for Clinical Genomics and Professor of Medicine at the Cleveland Clinic Lerner College of Medicine. First off, this is a topic that's gotten a lot of media attention, so I'm really glad you had some time. Let's start first with some background. I know you've had done some of the animal work in this. What are the animal studies showing us that are leading us to where we are now?
Well, we have actually known for a long time that in patients with heart failure, there is a lot of gut bacteria that is translocated and get into the systemic circulation. In fact, that's not only in animals, but it's been demonstrated by several groups, including a very prominent group in UK, actually demonstrated directly that there are bacterial and its materials that is leaking through the gut, and also metabolites that potentially also transfer. In fact, that's the entire spectrum of this concept has evolved to explain the inflammatory hypothesis of heart failure that has prevailed the last decade or so.
Precisely.
And potentially, especially with the advent of anti-TNF alpha antagonists, that was the whole idea that was trying to prove whether we could block that pathway. Unfortunately, that's something that we do need.
Right. And so it's not just the bacteria themselves, but it's the chemicals that they're producing that are causing problems.
Exactly. So it's almost like immunity. You have cellular and humoral immunity. There's actually the bacteria that actually translocates, but also the materials that the bacteria make or the response that the immune system go against the bacteria. And all these actually generate a huge amount of inflammatory response. And this is also not unique to heart failure, except that in patients with heart failure, the leakage of the gut is something that has been evolving over time, particularly in patients with congestion, where there's intestinal congestion that's caused this.
Right.
And so this paper has been kind of a direct demonstration of that.
Before we go to the paper specifically, how important is this topic of pathogenic gut flora? I mean, just broadly, not just heart failure, but you mentioned it yourself.
And I think that reflects on the title, it almost opens a whole new frontier of what we're going to look at, where we realize there's a holistic concept of heart failure being a very systemic condition. And it's not just the heart or the kidney, or it actually involves an entire spectrum of different aspects of the body. So I think the entire idea that there is a whole new compartment that need to be explored to understand why patients get sick is a very important concept.
Now, this particular paper, the main paper in JACC Heart Failure, tell me about it.
So this is an Italian group that has been very interested in this topic, and they actually collected a series of patients whom they actually do very specific tests to better understand the intestinal absorption, what they call the intestinal functional, the barrier function. So to try to directly demonstrate that there is leakage in patients with heart failure and try to understand what are the determinants. And what they did find is, number one, they did find that in patients with heart failure, particularly with right-sided problems where there's more congestion, there's a dramatic amount of impaired barrier function, meaning more leakage across by a simple sugar test. And the second thing that they found is that when they actually collect the biospecimens from patients, the circulating blood, and they actually try to culture it, they found actually colonies growing out, which really means that the concept of a sterile environment inside the body is actually not true. In fact, it is likely that these are active components that are occurring within the circulation. Now, obviously, one would wonder, aren't they sick? Are they septic and all that? And that's the interesting thing. We actually always live with this equilibrium. And so what we need to understand now is, why do some people continue to get sick, and why do people actually can get rid of these? Because all of us have circulating microbes around on a daily basis.
So the question becomes, what do you do about it?
Or what is the mechanism to which making this balance minimal, and also what are the strategies to try and both visualizing the physiology, what they have done, and also to see how it applies to different clinical settings. And that's where my editorial really expands on how it may explain several things that we are seeing at the bedside. And having this ability to find out different ways to characterize it, and also allowing different therapies to try and test to see whether we could alter it, is really a brand new area.
Yeah. So in your editorial, we are not alone, what do you think cardiologists need to know at this point?
Well, cardiologists need to know that we have been very good at characterizing the physiology of heart function, through multiple ways, through hemodynamic, through imaging, through multiple biomarker evaluation. What we need to understand is also the physiologic underpinnings of it. And because much better understanding of that allows us to actually take it into action and how to target therapy. Describing something doesn't really help us. We need to figure out how to actually alter it. The second thing is solely focusing on the heart may actually lead us away from what is otherwise a systemic condition. And so we need to look more holistically, almost like marine ecology. We have to look at how one organ interacts with other organs. And in this case, the heart does have a direct and indirect interaction with intestinal function. And there are other things that we also know that is related to both congestion and hemodynamics. They are directly related. And these are important things for us to recognize and diagnose and also evaluate in the course of taking care of patients.
So what are you and your colleagues working on right now? What over the course of the next year or two should we be listening for?
So I think there's much interest in this, and there has been. In fact, I mentioned the British group has continually described this phenomenon in patients with heart failure. Even in this meeting, there's a whole session on right heart failure that talks about how this interaction causes patients with cachexia, progressive deterioration, inflammatory response, etc. So clearly, this area will get a lot more information. There's actually also a lot of exciting things, particularly with improvement in technology and genomic technology that allows us to really characterize the presence of these microbes in the body. The whole world of microbiome is expanding. It's an enormous amount of information. In fact, the running joke is we are only 10% human, 90% microbes. So there's a huge amount of understanding that we will need to relate what we see at the bedside to these new information. Also, the most important part is not just who they are, but what do they do? So whether they are just being an innocent bystander, or actually they are producing some things that are actually harmful to us. And our research group has been very focused in some specific pathways that's related to what we eat with what the bacteria and the microbes actually convert that we want to remove from the body through through liver and kidney, and how this imbalance may actually related to cardiovascular disease, both in atherosclerotic coronary disease, as well as heart failure and cardiorenal syndrome. So those are important directions that have direct relevance to what we do on a daily basis, particularly how we actually understand what kind of intervention, potentially dietary or even pharmacologically, and also the potential monitoring and detection of progression.
Well, there was a phrase that I didn't think I'd ever say, but fecal transplant has been in the news, and it's like, now, I'm getting a better understanding now what they're doing, what they're trying to do, but the first time I read that, I'm going, okay, wasn't expecting that in my life as a science writer.
And I think part of it is not necessarily just a therapeutic approach, but actually a concept. And this concept has been around for almost all civilizations. If you think about it, that much of the traditional medicine concepts have focused around dietary, intervention with different sources of materials that the body can convert. And we have very little understanding, probably until now that we have technologies to actually understand it. So I think it's a really, really exciting time, and really potentially gave us a whole new perspective of cardiovascular disease.
Well, to look at that perspective up close and personal, please see the paper, the main paper in JACC Heart Failure, as well as the editorial comment. And for CardioSource World News, I'm Executive Editor Rick McGuire.